That's a difficult one because I think everyone's pregnancy is so different, but obviously there's some guidelines. And I think we have to kind of work within those guidelines, knowing that everyone's slightly different. In general, when I did a little bit of kind of chats with kind of Jodie Swallows in the past and a few other kind of athletes, is probably the biggest one is heart rate. Because obviously, if you were to use your heart rate where you're quite a high level athlete, at like kind of a low level, you'd be not really doing anything for yourself training wise. So the heart rate training would be something that I probably wouldn't look at as a gauge. I'd definitely do an RPE kind of Borg scale of kind of talk test, like 1 to 20, just as a gauge of how you're feeling, and you're working within that somewhat hard to hard level that's perceived for you. And that's a really nice way to do, because say compared to Susie, compared to Emma, your levels of training at somewhat hard would be very different to someone else who's a different type of athlete in a different field. So I think that's probably the biggest one. Do I use heart rate, or do I use another method of measuring my level of high end, you know, energy?